before I... Yes, sir.
Thank you for spending the time with us, Senator, as Bob Hertz did with the California Medical Association. Just touching on the domestic front, something that Republicans historically have had to take a little less initiative on, perhaps. Any thoughts on either the uninsured or long-term sustainability of Medicare? A couple of easy ones.
Yes, sir, and thank you for mentioning it. I should have probably mentioned earlier, but there's so many issues that are important. But in the town hall meetings that I have, the number one issue with the citizens who come to the town hall meetings their number one concern is health care. That's different from the 2000 or even the 2004 campaign. You know the reasons for it. There's fewer and fewer Americans that are able to afford health insurance. First of all, I would like to posit to you that we have the best medical care in the world in the United States of America. That's why when any foreign potentate gets sick, they come here for treatment. And so we've got to preserve that. And I would argue that the Democrats' plan for a single-payer, big government system, which many of them say also they have to raise taxes for, is not the way to go. Go to Canada, go to England, and see their systems, and I think you will see a strong argument against that kind of proposal. So therefore, we have to do, the burden of us that don't want that, it gets very complex in a way, because I think we need to do about 15 things, beginning with health insurance companies rewarding people for wellness and fitness, and HMO patients' bill of rights, medical malpractice reform, putting health care online, increasing community health centers, allowing small businesses to join together and negotiate with healthcare providers for lower income, lower health insurance premiums, allowing the insurance companies to reward people for wellness and fitness, allow us to import drugs from Canada much cheaper than they are today. The last bill, by the way, was written by the pharmaceutical companies, but I won't give you my rant on that one. But we have to take a number of concrete steps to, when someone loses their job and moves to another job, you've got to make sure they have an affordable health insurance plan as they move from one job to another. Not just the one they had, because then they assume the copay of the employer. As you know, we need tax credits for low-income Americans so that they can pay their health insurance premiums. We've got to bring inflation down in health care, or nothing that we will do will ever solve the problem. Inflation in this country for the last 10 years has been 1, 2, 2.5, etc. As you well know, health insurance inflation has been double-digit or slightly less. That's the evil we face. That's the problem that we face, is the inflation associated with healthcare. We can devise the best system in the world, and if you got double-digit inflation associated with it, it's gonna ultimately fail. So we've got to make this argument to the American people to resist, in my view, the siren song of single-payer, big government health insurance, and lay out for them a very cohesive plan and a comprehensive one. And it's going to be tough, because those who want the single-payer, big government solution, it takes them 30 seconds. How long does it take you and I to explain the various steps that we need to take to fix the system? But it is the number one issue with average citizens today, when we see this mobility and transience in the workforce, and they are very, very frightened about it. And frankly, they have every good reason to do so. Yes, sir. With that, I think that I am out of altitude, and airspeed, and ideas. May I say that I obviously am honored to be here with you. I thank you for all you've done for California and America, and I look forward to the opportunity of working with you in the future. Thanks very much.